Endometriosis is a chronic gynecological disease that affects about 1 in 10 women and can cause significant negative effects on an individual's day-to-day life. Although it is most commonly diagnosed in women in their 30s and 40s, endometriosis can begin in adolescence and can also affect postmenopausal women. With the guidance of patients, researchers, and clinical experts, the Society for Women's Health Research has designed a toolkit to assist individuals with endometriosis in navigating their care. Our Endometriosis Toolkit is a patient empowerment guide that provides easy-to-understand information and resources on menstrual health and stigma, understanding endometriosis, diagnosing and treating endometriosis, navigating endometriosis through the teenage years, pregnancy, and menopause, and managing a healthy lifestyle with endometriosis. This segment focuses on wellness tips for living with endometriosis. In endometriosis, tissue similar to the lining of the uterus grows outside the uterus where it doesn't belong, forming lesions that cause pelvic pain, heavy and irregular menstrual bleeding, and other potentially debilitating symptoms. An estimated 200 million individuals worldwide are living with endometriosis, and many more are undiagnosed. Tracking your menstrual cycle is a good way to give you and your healthcare provider a more complete picture of your symptoms, their severity, and their impact on your daily life. Using a calendar, notebook, or health app, record information like, my period started on Monday, May 10th and ended on Friday, May 14th. And day 2 was my heaviest flow day. I used 8 pads. You should also note both regular and unusual symptoms, such as severe pain in your lower back or pelvic region, headaches or trouble sleeping during your period, constipation or diarrhea, or if your monthly cycle was off by a few days. By recording your period experience each month, over time you can look back and see what normal and abnormal looks like for you. If you choose to use an app to track your menstrual cycle, the Federal Trade Commission provides guidance that you can read online about how to select and use health apps while reducing privacy risks. Here are some of the many apps to choose from. All of them are useful for tracking your period, but some have special features to assist with recording fertility and managing your endometriosis. Preparing in advance for your healthcare appointments and advocating for your own health may help you overcome potential hurdles to diagnosing and treating your endometriosis. A doctor's visit worksheet is provided in the appendix of SWHR's Endometriosis Toolkit for you to fill out and take with you on your visit. It allows you to write out key information to discuss with your provider, including your symptoms and their impact on your day-to-day activities, your medical history, including reproductive history, family history, and past gynecological tests, treatments, and surgeries, and a list of your current medications and other healthcare professionals you see. There are physical, emotional, and financial burdens associated with endometriosis. Studies have shown that this disease can cause, on average, more than 6 hours in lost productivity at work and almost 5 hours in lost productivity at home each week. However, here are some strategies to help you maintain a healthy and active lifestyle along your journey with endometriosis. When we exercise or participate in sports, we often push our bodies to physical limits. Listen to your body. It's important to pay extra attention to changes in pain that might aggravate your endometriosis symptoms. Low-intensity stretching exercises may help to relieve cramps and pain, so don't skip your warm-up and cool-down stretches. And be sure to give your body plenty of rest after long practices and events. Snack well. Healthy eating and staying hydrated can reduce inflammation and manage nausea and bowel issues associated with endometriosis. Keep fruits, veggies, and high-fiber snacks in your desk or work bag so you don't skip meals during a busy day. Stress and anxiety can increase muscle tension and inflammation that can flare up endometriosis symptoms and pain. Take mini breaks to stand or sit throughout the day and keep your body limber. Schedule regular opportunities to recharge your body and mind. If you travel, be prepared. Try to schedule travel during the less problematic times of your monthly cycle and make sure you have enough medication to last the trip. Continue your stretching exercises and routine after a long drive or flight, and journal what you eat and drink that might be different from your normal regimen at home. Prepare a handy endo survival kit with pads or tampons, pain medicine, and spare underwear that you can easily access on the go or during unexpected flare-ups. Ask for accommodation. In the United States, endometriosis is not classified as a disability, but you can still consider asking for reasonable accommodations at your school or workplace. Every environment is different, but accommodations might include a comfortable chair, scheduled breaks, adjusted or flexible hours, or remote work or attendance. Understand that this may require one or multiple conversations with your supervisor, institution, or human resources department, as well as documentation from you or your doctor explaining your condition and its challenges. Endometriosis can often affect your sexual health and wellness. Remember, you did not cause your endometriosis, and you have nothing to be ashamed about. If you have a partner, talk with them about how you are feeling physically and emotionally, and sit down together to figure out ways to make sex, intimacy, and reproduction work better for both of you. To help with pain during or after sex, try taking a pain reliever 1 hour before intercourse. You might consider taking your partner with you to consultations with your healthcare provider. Lastly, you don't have to battle endometriosis alone. Find a confidant or two that you can go to share your experiences and concerns. Ask them to hold you accountable for maintaining your health and wellness. You'd be surprised how many individuals you already know that would be willing to be in your circle of support. You can also expand your circle by exploring local or virtual support groups. Ask your doctor or search online for additional resources. For more information about endometriosis, or to download a copy of SWHR's Endometriosis Toolkit, a patient empowerment guide, visit our website, www.swhr.org. We also invite you to follow us on social media or sign up for a newsletter to get the latest in science, education, and policy concerning important women's health topics. The Society for Women's Health Research would like to thank everyone who contributed to the development of this toolkit, especially our Endometriosis Network, House Cat Creative Publishing LLC, and programmatic sponsor AbbVie.